Do you find yourself constantly dealing with fluid retention in your legs and feeling swollen? Today, I have a self-massage and exercise routine that can help alleviate your fluid retention and provide relief. Don't suffer any longer. Try these techniques now. Welcome to another day, another week at Fisiolution, your channel for physiotherapy, health and wellness. Today, we will discuss fluid retention and how to combat it. We will go through 3 phases that will greatly aid in reducing fluid retention. The first phase involves simple and superficial passes. To begin, loosen your hands and activate your circulation and circulatory system. With a slight bend in your leg, use gentle strokes called neurocutaneous strokes. Activate slowly, spending 5 minutes on each leg. Although it may seem like a short time, this preliminary phase greatly prepares your body for the subsequent phases. Moving on to the second phase, we will focus on lymphatic drainage to further treat fluid retention. Performing lymphatic drainage can be challenging for a therapist and even more so when done on oneself. However, I will provide some helpful tips to guide you. Start by using soft hands and applying tangential force. It is crucial to exert very little pressure, no more than 30 millimeters of mercury, with a maximum of 60 millimeters. Throughout the process, ensure that your hand does not slip. We want the hand to fall and create a dynamic tension movement on the skin without causing any harm. Sliding or leaning will not produce the desired results. Remember, the lymphatic system is superficial, so our focus should solely be on stimulating the lymphatic system without affecting circulation. Hence, the recommended pressure limits are 30 millimeters of mercury for most areas and up to 60 millimeters for distal regions. In the targeted area, utilize tangential pressure and pumping without exceeding the specified limits. Avoid using creams during this process. However, you can occasionally apply a small amount of talcum powder to prevent the skin from slipping, ensuring the lymphatic drainage technique is efficient. Having explained the lymphatic drainage technique, we will now proceed with a groin node drainage exercise. To do this, identify the iliac spine and the trochanter as your reference points. The symphysis pubis forms a triangle where all the nodes are located. With your hand, develop a downward motion, applying slight pressure. By following these guidelines, you will be better equipped to combat fluid retention and promote overall wellness. Remember to perform the exercises with care and stick to the recommended pressure limits. With consistent practice, you can effectively manage fluid retention and improve your health. Thank you for choosing Physiolution, your trusted source for physiotherapy, health, and wellness information. And we are just going to do a gentle and slow pumping. Okay? We're going to do that technique for 2 minutes. Isa, we're going to adapt both hands. This is the area that we need to grab. We support the little hands. We drop a little bit, covering a lot, and it's very slow. Circle without breaking the elastic tension, without sliding the hand. Simply. As we move, we should not exert excessive pressure on the skin, allowing it to stretch naturally. I mentioned earlier that we use 30 millimeters of mercury for this technique. We will now proceed with the first phase of our lymphatic drainage, which lasts for 2 minutes. Prior to this, we have already attended to the ganglions and inguinals and will now continue. To do so, let's flex the leg and come into a 4-legged position slightly. This will help us target and work on the groin area. We have already addressed the iliac spine and the trochanter region that we previously discussed. Moving forward, we are now shifting our focus directly to this area. As we bring the hand down, let's provide as much support as possible. Our aim is to generate maximum stability in this position. A pumping effect for 2 minutes in the poses that I'm going to tell you about. This would be the first post, okay? And this would be the second post. You will notice that there is more elasticity through the skin. It will let you work more or less, but it is very important not to slide the hand. We hold the elastic resistance gently and perform the movements very slowly. Using your right hand, adapt the resistance and let it fall, allowing it to come into contact with your skin. Begin the drainage technique in a circular pumping motion. There are various techniques like giving, rubbing, and the one we started with. However, these are the simplest techniques that you can easily do yourself at home. Spend 2 minutes in each area, covering the next area with your hand and continuing for another 2 minutes. Make sure to use soft, slow, and relaxed movements with gentle pressure. We must avoid overstimulation and only target the lymphatic system, not the circulatory system. Our goal is to touch the lymphatic system without overstimulating it, without stimulating the circulatory system. The next pose, we're going to switch legs, okay? We're going to flex it and we're going to put our little hand underneath the popliteal fossa. And it's as simple as adapting. And generate also there a little pump. A gentle pump. We are going to adapt the hand ISA. That's it, we adapt, not with a lot of pressure, and we make a circular pumping movement. 2 minutes. That's perfect. Once we move beyond focusing solely on the leg muscles like the quadriceps, hamstring and adductor, as well as the various lymph nodes in the body, we will proceed with this particular sequence. We will begin by, we take upwards. We pick up, we take upwards towards the nodes, okay? From the groin to what this whole structure is. Open up the leg a little bit. We have to come here, so we must take the necessary steps. All the lymph and take it to its collection point. We take lymph and take it to the collection point. Come on, we go on a little bit. We would do 2 or 3 posts, okay? Getting the hands out of here. And the next post, easily. You can make 3 posts if you have exceptionally long legs and can stretch farther. That's it, further down. We pick up and go all the way down to the groin. We pick up and take it to the groin. That's it? That's perfect. Finally, we will move on to the ankle. Let's go back to the other leg so you can have a better view. When it comes to the ankle, my aim is to create a gentle compression of 60 grams per millimeter of mercury using 3 pressure points. Apply a slight squeeze and focus on the feet. These massages should always be conducted in a proximal to distal direction, which is different from circulatory massages that go from distal to proximal. Apply compression for a few seconds. Now, let's adjust the position of our hands. Count with me. 1, 2, 3, 4. Transition slowly to the new position. 1, 2, 3, 4. Now, focus on the fingers. 1, 2, 3, 4. Remember to apply gentle pressure, not too firm. Now back to the ankle. 1, 2, 3, 4. Alternate the pressure points. 1, 2, 3, 4. 1, 2, 3, 4. Techniques that can differ between 1 minute and 2 minutes. To complete the process, concluding the lymphatic drainage involves gently using soft hands to massage the skin, resulting in extensive contact. This technique should be maintained for approximately 2 minutes. Through this, we can gather any remaining lymph that may not have been collected during the pumping process, effectively emptying the passenger train. It is important to initiate this massage from proximal areas and gradually work towards distal regions. By doing so, we ensure that all the lymph is thoroughly removed and reaches the inguinal ganglions. The lymphatic system, made up of lymphatic vessels and lymph nodes, is crucial for the human body. Its main purpose is to transport lymph, a clear fluid that carries white blood cells, throughout the body. Lymph helps purify toxins and waste, while also assisting in the fight against infections. This system plays a vital role in maintaining overall health. The lymphatic system plays a fundamental role in the process of fluid retention. The effects of lymphatic drainage on the body are anti-edematous. By draining, the lymphatic drainage improves the return circulation, avoids accumulation of liquids and residues, sedative and analgesic, inhibiting painful stimuli, reflects parasympathetic stimulation, relaxes the musculature, activates intestinal automatism, fights constipation, increases the immune defense. In this self-massage routine, the third phase helps to alleviate fluid retention. 100 massage, we have already stimulated in the lymphatic angel. Now let's stimulate the circulatory system. You already know that I like to rely on quality creams. Well, as easy as generating. In order to improve circulation, a tube drainage is performed, starting from the distal end and moving towards the proximal end. We use Isa, who is already well trained in performing massages on herself, as shown in our videos. To enhance circulation, Isa gently places her hand on the leg without causing any discomfort. This method, known as the totally palmar massage, involves using the entire palm to stimulate circulation without inserting fingers. We employ a highly effective technique called the funnel technique, where we apply pressure and move upwards as if we were extracting all the blood from the leg. This technique can be adjusted and tailored to individual needs. The massage is performed for a duration of 5 minutes, not as an exercise, but rather as a means to alleviate fluid retention. However, self-massage is not the only method we recommend for fluid retention. We will now switch to a different approach by utilizing a wall. Thanks to the availability of a practical stretcher, I am able to perform the following exercise for fluid retention. Let's provide support for our legs by performing gravity contractions and a sequence of movements. To start, we'll place our legs against the wall with our fingers facing towards us and squeeze our quadriceps for a 5-second count. 1, 2, 3, 4, 5. Afterward, we can bend our knees. This set of exercises in 3 different positions is remarkably straightforward. Activate the calf by standing on tiptoes. Count 1, 2, 3, 4, 5. Relax and raise the gluteal muscles. Count again. 1, 2, 3, 4, 5. Lower the body and stretch the legs gradually. Fingers towards us. 1, 2, 3, 4, 5. Flex. Activate calf. 1, 2, 3, 4, 5. Bend and assist in raising. 1, 2, 3, 4, 5. Keep the movement smooth and steady. This routine should be done for a minimum of 2 minutes. I would go between 5 and even more. What for? To activate the muscle contraction that makes the venous return is incentivized. And also, gravity gives us a hand. Exercise is always without pain and each one at his own pace. Guys, if you have fluid retention, do this routine daily without fear. Even mornings and evenings you can do it. Avoid standing for long periods of time in a static position. In order to combat fluid retention, it may be beneficial to wear compression stockings. It is also important to maintain a healthy diet and exercise regularly. Text reformulated to approximately 216 characters. If you have been searching for additional exercises to enhance your blood circulation, I have provided a video above featuring a collection of beneficial exercises. As we always remind with heartfelt affection, may you find healing or to healing and beyond. Farewell, farewell, and farewell once more.